What made you choose medicine?
You've gone through it too. We've worked shift after shift after shift.
But I knew that films was something that I wanted to do.
Medicine is one of those domains where you will continuously be learning your whole life.
Actually, after I got married, I lived my life.
The practice of medicine is one thing, the business is quite another. And most of us love the practice, we hate the business.
Right. Different people choose different paths in their lives. I think I saw mine very clearly, though I was a science student. But I knew that films was something that I wanted to do because arts was always a part of my life, like singing, dancing, and acting. Everything was a part of my life. But how does someone who has everything choose his path? I think, Ram, I would like to ask you that you were a technology guy. You did a lot of things, whether it's anything to do with property, or you did so many courses other than science and math and everything that everybody does. What made you choose medicine?
Hey guys, I'm Dr. Nene, a US trained cardiac, thoracic, and vascular surgeon and a general surgeon. As a healthcare innovator and a health tech innovator, I want to empower you to your best health ever. On this channel, we will share evidence-based medicine from all of us to you through our experiences and training about health and healthcare. The goal is to help you make informed decisions about your own health as well as that of your loved ones. We're here for you, so don't hesitate to reach out.
So it's a great question. I think what's intriguing to me about medicine and healthcare is it combined some of my underlying interests. Number one, I love to learn. And there's no question in my mind that medicine is one of those domains where you will continuously be learning your whole life. The second is you take care of a lot of good people at a very critical part of their lives. And the rewards in the friends and family that you create are phenomenal. And then the third is I'm very mechanically inclined. And so for me in particular, surgery kind of fit because I got to work with my hands and build things and change them and alter them. And the interesting part was they actually worked and how they worked. So I would say that, healthcare was something which, kind of appealed to my passionate humanistic side at the same time as appealing to my scientific and technological side. And I would say that was what drove me into medicine.
But I remember that when you were very young, at 14, you had your own company, a technological company. Would you like to talk about that a little bit?
Yeah, so I was a very intrepid adventurer, and my folks had got me a then very revolutionary computer, an Apple IIe, and I learned to program on my own. And it allowed me to explore worlds and to create things. And to be honest with you, I wanted to do business and technology originally. And what's interesting as parents is you see what's in vogue at the time. And back then, for an immigrant child, becoming a doctor, doctors were always doing well, right?
Yeah.
You always had a steady job, a steady income. You were always doing well. And so it taught me something that you have to really use all that you have at your disposal. And, medicine was incredibly arduous. Back then, even more so now. But it was something which intrigued me as well.
I have seen you work really hard. I mean, when we got married, you were doing a residency in Florida, and it was like every other day call. And I remember I wouldn't see you for like days together, like 3-4 days, because you'd been working, sleepless nights. And by the time you would come home, you would be so tired that you wouldn't even eat your dinner. You would just go to sleep, just collapse, basically. What do you think of that? And how does all that hard work kind of, produce the effects? And
So,
what do you think?
So I think it's a great question because let's be honest, right? You've gone through it too. We've worked shift after shift after shift, and medicine is the ultimate endurance run.
Yeah.
Because in the US at least, you have to do 4 years of undergrad, be the best in your field, do the pre-medical requirements, do the testing, and end up on top. You have to then do 4 years of medical school, and you have the first 2 years, which are, first year is the healthy year, the second year is the pathologic year, third year is clinical clerkships, and the fourth year is electives. And then after that, depending on what you do, like in my case, I did general surgery, I did a vascular surgery research fellowship, and then I did a cardiothoracic fellowship. And we got married when I had just finished my general surgery chief residency
from UCLA.
At UCLA, and then we were going to Florida for the thoracic fellowship. But I would say the arduous hours were very challenging, and that's changed a little bit. It used to be that you were working 120, 130 hours, 40 hours on, 8 hours off. That's changed since the Libby Zion ruling in New York, where you can only do 80 hours, which I think is a good thing. I mean, they shouldn't treat you inhumanely so that you can behave humanely. But more than that, from a patient safety standpoint, it is something which adds. But more than that, your whole educational experience when you're working that many hours is challenging.
Right.
But having said that, it creates a soldier, because you can do anything. And the interesting part is, as hard as I worked in residency and fellowship, I worked harder as an attending, because there everything stopped at me.
Right.
And people trusted you and they wanted you to do their cases. So when you got a referral, if you said no, then they wouldn't send you referrals, because they counted on you. And so I would say it trained you well to take care of patients. And so, that's been a central theme for me, that no matter what I do, the challenges I had as a cardiothoracic and vascular surgeon and as a doctor, and just getting there as well as maintaining it, and even now, as I've maintained my continuing medical education and all that, and now just moved into an area where I can scale the reach,
Right.
It has trained me to be so much more than what I could have been just with what's in front of me.
Right.
So I don't regret some of that. What I do regret is the hours lost with family and friends. So I think that was no more evident than in the pandemic, where people were putting their lives on the line and giving their lives for the sake of their patients, and we did the same, right? You couldn't take a break unless you were intubated or on a ventilator or in an ICU with IVs. Even if you were sick, you had to go to work and wear a mask and take care. So I would say that was the challenge of medicine. I think nowadays what's happened for us is the practice of medicine is one thing, the business is quite another. And most of us love the practice, we hate the business.
Right. But do you think like the adventurous side of you, like you wouldn't hesitate to jump off a cliff, do bungee jumping, you played tennis in your varsity team and everything. And with the same, fervor, you kind of used to play video games, and you were like an all-rounder. And you think that helped you as well when you had to do those robotic, surgeries and everything. I mean, I've seen that machine, and I've actually felt it.
Yeah.
It's pretty hard. It's hard. It's you have to have both sides of your brain working really well to actually do the surgery, and you have done a lot of those surgeries.
So outstanding question. It's what we train our kids to do, right? That everything comes together, and you try to bring all of your subsets, and you need to do what you love, and then apply it. And I'm the first to admit I'll never know everything. It's like infinity, keep counting, you'll never get there. But I enjoy the chase, and I think the very virtue of what I did, what you did, we were driven, and we still are. And that's what makes us who we are. And I think what's apparent with the kids is they see that. We don't have to teach them that. They see what we, sort of look at. The second thing is, in my upbringing, my parents were fairly conservative. And so they really didn't have a lot of latitude, mainly because they didn't have a lot of backup systems, right?
Yeah. So today with our kids, we know that we want them to go into the world and do what they want to do, because we know that we can be like their little, comfort zone, where if they have to fall back, they can, depend on us to help them also at some point. And I think that also kind of shows in your the way you deal with the kids, because you want them to learn everything. You want them, to do sports or music. You've never stopped them from doing anything, other than just study and just get these marks and you have to be a doctor or an engineer or you have to be a particular way. We want them to follow their passion, right?
Yeah. So I think it's important, and that what's critical is do what you love. I think one thing we should talk about is where I think healthcare is going now.
Right, yeah.
So what are your thoughts? What are the challenges you face in your healthcare journey, and what is it you think most of our friends and family face?
See, first of all, I think the most important thing in India especially is that people don't go to the doctor unless they are really sick. Like they are ending up in the hospital or something catastrophic happens to them. Then they go to the doctor, and I think that is the biggest issue I see in people in general, that they don't do preventative, or they will not, try to lead a healthy life and be in touch with the doctor and like a continuity of care kind of a system. I think we don't have that here.
So I would agree. I think the critical numbers are the issue, and part of the reason why I'm on my journey now. There's 1.8 million docs, of which 1 million are allopathic in India, and globally it's if not similar, it's in the same proportion. In India, though, we have 1.412 billion patients, and 70% of those are in rural areas, which are fairly underserved. 30% are in metro areas, which can have good care. Now, this is true globally. You see in the US, there aren't enough doctors to go around. What I see happening is we need to change the paradigm to one where we practice prevention, early recognition, early treatment, but we need to empower patients to take care of themselves, and like you said, not come in just when they're sick. So as a physician, the hardest part, which I struggle with, is the infrastructure of medicine. There's not enough people to really take care of everyone. And there's this huge gap when they leave the hospital or leave my clinic or leave my operating room where they could potentially come to harm. And so I think what we need to do is build a instinctive system in place which relies on the patient first, looking at their genetics, their medical history, their family history, their past medical history, their social history, their socioeconomic background, and also looking at their goals from the cradle to the grave as where they need to be. In doing that, we can best triage or figure out who needs to go to where when. And look, there's going to be situations where we don't have enough to go around. And there, we need to try to democratize healthcare by getting the people who need it the most to the places they need to go to. Not everyone needs the most advanced stuff all the time. But the key is who can provide us with that. And the hard part for me is how the economics, the unit economics work, how burnout in medicine. So in the US, it's estimated 120,000 practicing physicians will retire, only 40,000 will go and replace them. And the real question, this was an article in the New York Times last week, which I put on my timelines. And the real question which people are asking is, are the best and brightest going into medicine now? And is this something which is sustainable long term? I think that technology has to come in. We have to use some kind of generative AI. We have to use virtual instances. We have to use dashboards. But that aside, I don't think you'll be able to replace a great doctor or nurse or healthcare practitioner. You're always going to need that. Now the question is, how do we train the next generation? How do we make it worth their while? Because a lot of people don't want to do it because they see easier paths. I mean, functionally as a physician, you spend a great deal of your early training working your tail off with no apparent...
You put a lot of years of your life into it.
You do, and no regret that way. But in, coming to India, the idea was to use those skills along with my original skills to scale medicine to 8 billion people using media tech and smart services. And so they ask, well, are you still practicing? Are you doing all that? And I said, well, as a heart surgeon, I could do 3 to 5 cases in a day. And if you took that in 1 year, I would see maybe 500 cases and see another 2,000
Right.
consults. There's very few heart surgeons. They're very limited specialty, limited in the sense that there are a lot of heart surgeries, but in terms of actual heart surgeons, there are very few. But it's not a scalable instance. And for that matter, medicine to some degree is not scalable. So in doing what we're doing now, I'm trying to figure out ways to give medicine to everyone at an affordable
Right.
means, and also one which improves outcomes for all of the shareholders, meaning the patient, the doctors, the hospitals, the countries, and all of the intermediaries in between. So that brings up another point. What's it like to be the spouse of a physician? I'm sure a lot of people are wondering.
Yeah, I mean, it's tough in the sense because of the kind of times you have to keep, whether it's day, night, and the call schedule. Sometimes you're every other day call. Sometimes you're on like maybe one day, skip one day and he's on call. So it's hard because then you are the one who's looking after the kids and little things like taking them to the school, getting them back, and doing stuff for them. Also the timing. Sometimes there might be something important that's happening, but you're not there because you're in the hospital looking after someone else. Sometimes I might be sick, but you have to take care of someone else. So those are the things. But I guess it's also so heartening, and I always used to feel so proud of you because whenever I saw you being so concerned about the patients you're looking after, or fighting for them or fighting for their rights. I remember one woman, you really fought hard so that she could get on the heart transplant list, but because of whatever reasons it was not possible. And that was the first time I saw you feeling so defeated and feeling so bad about it. It just gives the human side of you, and I could see that, and which kind of makes me feel proud as well as I understand what you're going through, and I know that in the hearts of hearts you are a very, very good person. And so I think in a marriage that's very important, to know your partner, and and whenever you used to be home, you used to just take over. And I remember one day he was out at the hospital 4 or 5 days, and I had not seen him, and I was looking, and both my kids were really small, so it's a little hard to look after them. But when he came home, he was like, just give me like these 4 hours, I'm going to sleep, and then after that you go out and do whatever you want to, I will look after the kids. So we always had that partnership where we looked after each other and made sure the kids were always looked after and always felt loved and cared for. So I guess there are times when it's a little difficult, but there are also times when we know that whatever we are doing in life, it's for the good. It's for it's something that we both want. It's our goals, common goals. And if I was a doctor, that is how I would be. When I see you, it's been there are like very good times. There's some difficult times. But overall, I mean, it's been a lovely journey. And when the kids look at their mom and dad and the way they are leading their lives, how hard they're working, there's so much they learn also from it. And that's what is, great for the kids. The kids always understood what you were going through, and, you used to talk to the kids like, you always talk to them like adults and tell them what's happening and give them the right not baby them and say, "Nahi, beta," not like that. He used to talk to them like people, and they, I think, understand a lot more about your life, my life, and their own lives because of the way we handle them or brought them up, or the way we conversed with them. And I think it's been a fab journey because you can also be completely adventurous guy. We used to go out. I think literally, people used to ask me, how was your life before you got married? I said, before I got married, all I knew was work, work, work. But actually, after I got married, I lived my life. Because we went out, we traveled a lot, and we did a lot of adventure sports, which I'd never done before. So did all kinds of stuff, and I think it just enriched my life, and I think it made me a better person. It gave me also, a flight of fancy sometimes. So I think the good always comes with the bad, but the bads were so like minuscule, I think, that it's been a beautiful journey for me.
So I think, having a supportive spouse like this, who loves and cares about you regardless of what happens, is critical to the journey. And I think both of us have very challenging careers, but
I remember sometimes when the kids were very young, and both my kids are just 2 years apart. So the younger one was born and the older one was just 2 years old. And I remember he used to work so hard that he had come home and his pager was going off. But he had not slept for 3 days and 3 nights, right? You had not slept, and he was home and the pager was going off. I had to go and wake him up and say, Ram, your pager is going off, So I know how hard he's worked, and he knows how hard I've worked. And we have a lot of respect for each other for that.
Yeah, and so I think it can be challenging, and it's like everything else everyone does. Everyone has their set of difficulties through their careers, through their lives. I think the marriage should be a partnership for sure, and nowadays it's more so than in the olden days where it was more paternalistic. I think the other thing is, as a heart surgeon, we tend to be very organized, because every little detail, I joke about millimeters and milliseconds making the difference between life and death. And sometimes you get caught in the minutia that you forget to look at the big picture and the little picture. And so every little thing is overthought sometimes in my life. And heart surgeons retire, their wives kick them out of the house because they'll go and organize every doggone cabinet, make sure that the workflow is proper, make sure that every last detail is managed. I think there has to be a balance. And nowadays it's changed a little bit with medicine in that the newer generation coming out are not just doing it for work alone, but they're actually living lives. And that's true with millennials in general, that they're renting their experiences, not buying their troubles. And so they tend to not be as drawn to things. That said, our generation was very dedicated, very focused, and very driven. And there were reasons then, and there's reasons now. But I've enjoyed this, and it gives you some insight into what you go through to get into medicine and why you would do it. It also gives you an insight into how your family will be affected. As far as where medicine is heading, it's a very interesting question and puzzle, because we don't have enough docs to go around, and there's way more patients coming every single day. So I think with the advent of technology, media, and people kind of relying on each other, it will improve. But the real question is, will the docs be there when we need them? And will they want to do what they do? I would say that unless they get the help they need, from an infrastructure standpoint, it's going to be challenging. The second thing is they need a better way to create doctors. And there aren't enough schools, clearly, but just to get into the school, you have to be the best and brightest, and it's so doggone arduous. And I think that standard should be there, because you don't want someone who's at the bottom of the scale becoming, the best, or becoming someone who takes care of another person unless they're competent. But I think with other measures, we'll be able to make a bigger scale and get different levels of care, which will be appropriate for triage and for taking care of common stuff versus other stuff. And I think some of the technology will help there too.
Also, I think developing infrastructure is very important, because
100%.
that healthcare can go to all these little nooks and corners of the country. Because like you said, 70% is rural, where they don't have enough infrastructure. So that also needs to be worked on.
And I think it also has to be re-education, because people shouldn't just go to the doctor when they're sick.
Yeah.
Right? They need to think about health as a continuum from the cradle to the grave, and how they're going to get there to live a long and fruitful life. Because, it's like one of my mentors said, that from the day you're born, at some point you'll pass, but you should never suffer. So I think there's a lot to be talked about, and this should start the dialogue. Would love to hear what you guys say, and by all means leave comments in the boxes below. As always, hit the like button if you like what we're saying. Subscribe to the channel so you'll get even more of our content and help us to kind of steer it. And then finally, share it with everyone you know, because it's a pleasure for us to make it. It's even more of a pleasure when you actually have it be appreciated by everyone out there. Thank you so much for joining us.
Do let us know what you think.